So I just want to, first of all, just say welcome to everybody. My name is Jeannie McNabb, and I'm the project manager for the King County Regional Homelessness Authority. And until the authority is officially set up and has its own staff, in the interim, I, along with a colleague of mine at the City of Seattle who is not here tonight, but will be at future meetings, we will staff you in this meeting. And I also just want to make a quick mention that this, as I've already said, there's a bit of a learning curve happening for us as we figure out how to do these meetings in the virtual environment. So bear with us as we practice that. One thing, there's going to be a change to the agenda because we had planned for a breakout room, and that's not going to work in this setup. And with that, I want to turn this over to Executive Constantine, who is here representing the King County Regional Homelessness Authority Governing Committee and is here to welcome you.
Well, thank you, Jeannie. And thanks to everyone. I'm honored to welcome you to the inaugural meeting of the King County Regional Homelessness Authority Implementation Board. We are enormously grateful, and when I say we, I mean really everyone in the region is immensely grateful for your willingness to serve in this role and to share your expertise and perspective as we work together to improve the lives of people living homeless. The establishment of the King County Regional Homelessness Authority is unprecedented in several senses, but it is in this way that I'm talking about now, an unprecedented collaboration between the regional government, which is King County, which I'm the head, of our 39 city governments, including Seattle and the members of the Sound Cities Association. And I think most importantly and most indicative of the direction that we are intending to go with this and other work, our colleagues representing those with lived experience. We are all working to transform how we help everyone, help every person find a safe, secure place to call home. This authority is tasked with knitting together a fractured system that we currently have been working with and around to figure out how we can improve the coordination of both services and funding, and making sure that it is region-wide, county-wide, and not happening robustly in one place and not at all in another, just based on accidents of boundaries and geography. And figuring out how to grasp this opportunity to reduce the unacceptable disproportionality of homelessness among communities of color, the disproportionality of homelessness based on race. Now, with this authority, we are acting as a region, and that is how we are trying to evolve our thinking in many areas of our shared responsibility on protecting the environment and creating mobility and creating economic opportunity and dealing with some of the enormous challenges that we have around the results of economic inequities and racism that's embedded in our systems. We have to act regionally to provide comprehensive services, using evidence-based practices and centering people with lived experience of homelessness to bring everyone inside. As implementation board members, you will play the vital role in ensuring that the authority is well run and that it provides the best services to all county residents who are living homeless. You're going to make recommendations to the governing board. You're going to oversee the implementation of plans, of budgets, of operations for the authority to ensure that best practices and data-informed decision-making bring forward genuinely effective solutions. So I want to start by thanking you, I guess in advance, for your service. And I and we all look forward eagerly to working with you. Thank you so much for being here tonight and being here for the long haul.
Thanks so much, Executive Constantine. As we jump into our agenda, my colleague Carrie Flory is just going to, for people who may not have been on a Zoom meeting like this, she just has a couple of tips and tricks for you for how to unmute yourselves and raise your hand and various things.
Hi, everyone. We will be conducting this meeting via Zoom. At various points in the meeting, we'll engage in group discussion. So to ask questions or share a comment, please raise your hand by clicking the button on the right side of your screen. If you don't see it there, it could be under participants or chat. You will then be entered into a queue, and when discussions formally begin, I will call on you in the order in which you raised your hand. After your turn, you can raise your hand again to be entered back into the queue. If you have any problems with raising your hand, muting or unmuting, or any other Zoom etiquette, please comment me using the chat function and I can work with you to help solve the problem. So I wanted to see if folks wanted to give that a try. If folks can try to raise their hand using that function. Great, I see some of you.
Find it.
Yeah, I'm having trouble finding it. I apologize.
That's okay. It's a little bit different when you're a host from when you're an attendee. So let's see, folks. Look under participants. Thanks for that tip. So if you click on participants function.
Oh, thank you.
Yeah. Let's see if.
Oh, there's the more.
There you go, with more.
It's not. That's all right. I'll be quiet today.
Yeah, and for the purposes of this meeting, feel free to just put your hand in the air. We can definitely work with that too as we're all figuring this out. We wanted to start off with just acknowledging who's here in the room, and what I wanted to do was just go through our implementation board members, call out your name, and if you just want to introduce yourself and say a word or two about how the perspective and life and work experience that you are bringing to this board. And I think you all are arranged in kind of random order on my screen, and I'm going to go with that. So Harold Odom, you want to go ahead and, if you're unmuted, and just introduce yourself.
Wow. So my name is Harold. I'm with the Lived Experience Coalition. And when I come to this board, I come with a seat that's full of people. It's not just what I'm thinking, it's about what the community that I serve. Over the years, we've heard many of things in many ways that people have tried to end homelessness. My perspective is, if we try something new, try serving the people that we serve, through theory of change, through dropping off those old behaviors that we go through, those service providers that are just not working. Try something new. Because your best thinking has got us where we are now. More people dying on the street, more people homeless, and it's the disparity and the big changes between black, white is horrific. If you're not in that community, you can look at it from afar and say, I can deal with it by proxy. I'm in that community, and I serve that community. I intentionally will be here for that community. Like Tammy Morales said, let's be clear. I'm here to serve those people who have been on the margins, the black, brown community of our community that has been least served by so many politicians, so many service providers. My seat is full of those people, and I bring their voices here. Thank you.
Thanks, Harold. Simha, ready? You just need to unmute yourself.
Yeah. Hi, my name is Simha Reddy. I'm a primary care physician, and I serve as the medical director for VA Puget Sound's homeless veteran program, or homeless, I've been doing that for about 8 years or so. And I think the biggest reason I wanted to join this board was, one, it is painful to watch your patients and the people you care about struggle and not find the resources that they need often. But actually, I think it was COVID that sort of changed things for me. One, it created a sense of urgency, but also the sense of possibility, that things that in ways I hadn't even realized before that had sort of limited myself thinking about. I think in this moment, we are capable of taking things to scale, really thinking large and addressing this problem, hopefully in a new and more effective way. Anyway, thanks.
Thank you. John Chelminiak, I think I said that right.
That's right. That's perfect. So I'm John Chelminiak, lifelong resident of the area. Was born in West Seattle. My parents actually saved the receipt. I've said that they actually were thinking of returning me. I found it after I was going through my father's estate. So I really became more heavily involved in the homeless issue as a result of my service through the Bellevue City Council. And quite frankly, it was because I lost a vote to be mayor. And that person gave me the worst assignment you could have in his mind, which was liaison to the Human Services Commission. And I decided I was just simply going to go in and do the best job I could and be a strong advocate for human services. That was at a time that, actually, I guess that was 2010. It was at a time that we were under great strain with budgets because of the Great Recession. And I went in and convinced my fellow members, rather than cutting money to the human services, that we should dip into our rainy day fund and add money to the human services. Very heavily involved, very passionate about having a roof over the head. That's what it says in our comprehensive plan. So I was passionate about getting a permanent shelter built here. Not there yet, but we're very much closer to it. And in part because of the help of Dow Constantine and Adrian when they were at the county. So I bring this passion for a solution and a recognition that what we've been doing and the way we've tried to do it, as Mr. Odom said, hasn't worked. So thank you.
Thanks, John. Juanita? Juanita, I can't hear you. I'm going to go ahead and switch to someone else. We'll just keep moving and then we'll come back to you, Juanita, so we can hear you. Helen Howell?
Hi, Helen Howell. I'm currently with the King County Housing Authority. I run their social impact department and currently am running the Housing Choice Voucher Program until we get a new head of operations. So I'm a lawyer by training. I've done a lot of policy work at the federal, state, and local level. I've been involved in homeless issues since I ran the Pierce County Human Services Department. And I did that for about 5 years, and that's where I got introduced to some of these issues around homeless services, affordable housing, etc. In addition, I served as executive director of Building Changes, a nonprofit organization focused on youth and family homelessness. I very much support this regional approach to addressing this challenge in our community. And I'm hopeful about what we might be able to accomplish together. I think we also need to recognize regularly that we need more resources and that there's an insufficient supply of affordable housing, and it's a very serious need.
Thanks, Helen. Gordon McHenry, Jr.
Good evening, all. Gordon McHenry, and I'm currently the President and CEO of United Way of King County. We're very much focused on stable housing for all members of our King County community. Like Helen, I'm a trained attorney, and I'm not practicing, so I think of myself as a social justice advocate, and I'm trying to do my best at United Way, previously at Solid Ground, prior to that at Rainier Scholars. So a lot of focus. And then before that, I was in the private sector with the Boeing Company. So I'm relatively competent in moving between worlds. And I think that our region's greatest problems are ones that need active participation, collaboration by the private sector, the public sector, and nonprofit philanthropy. So I hope I can be effective in that way. Born and raised in King County, and in a community I love very much, and have high aspirations for. I have a lot of personal privilege, and I recognize that, and I'm very concerned that so many of our members of our community are suffering haves with have-nots and with systemic oppressions, and so we'll try to bring that lens to this work. I should be transparent and say that I was co-chair of the All Home Coordinating Board for a couple years, so I worked very closely with Adrian and with Leo and others on this call. I believe in regionalism, and I was a real strong advocate for having a regional approach to ending homelessness and housing instability. And so happy to be back working on that again and working with all of you. Thank you so much.
Thanks, Gordon. Paula Carvalho?
Carvalho.
Carvalho, thank you.
No problem. So Paula Carvalho, I use she, her pronouns. I am the program officer in youth homelessness at the Rakes Foundation. I literally just celebrated my 1 year yesterday, but I come from the Mockingbird Society. I was a director of youth programs focusing on youth development and systems reform. So lots of work around engaging young people. I've spent my, entire career, maybe about like 11 years, working with young people experiencing homelessness and foster care, most specifically on young people transitioning out of systems. Also someone who has experienced both foster care and homelessness. And so I'm really excited to be on this board. And I know that the supported the stand-up of this regional authority a little bit before my time, but happy to be on it now.
Thanks, Paula. Adrian Quinn.
Hi, good to see all of you tonight. I'm Adrian Quinn, and homelessness is a personal issue for me, and one in which I've devoted a substantial amount of my professional efforts as well. Currently, I have a brother who has been homeless for more than a decade, and have had other family members who experienced homelessness as well. Currently, I am a professor at the UW Evans School of Public Policy and Governance. Prior to that, I was director for King County Department of Community and Human Services, and then before that, executive director of the Medina Foundation, and director of Seattle's Office of Housing. So this is an issue that I have been working on for quite some time, and I am thrilled that with the progress that we're making right now in terms of some tremendous structural change, which I know was difficult to make for at least 15 years. All Home, and then before that, the Committee to End Homelessness was an organization that had no money, no power, and tremendous responsibility. And now we are shifting that, and I think that will position our community to make substantially greater changes by that alignment, and also with a new and renewed focus on making sure that the people who are experiencing homelessness have voice, and we're focusing on the disproportionality in homelessness.
Thanks, Adrian. Juanita, I can see you now on the screen. Should we try and see if we can hear you now? If you just unmute yourself. Juanita, and this is Juanita Spotted Elk.
Hi, everybody. I was having some technical difficulties, but I'm back on. So I'm just grateful to be here. I'm grateful for just all this work. I believe it's sacred work. And I'm Northern Cheyenne from Montana. That's my tribe, and I always want to remember or be mindful that we always need to help from the unseen and recognize and acknowledge this territory, and just raise my hands up to everybody. And I believe that everyone doing this work is sacred, and that it takes everyone's help to bring all these changes. And I'm from the LEC, Lived Experience Coalition. I'm part of the leadership team, and it's just a blessing to be here. Hi, everyone. Thank you.
Thanks, Juanita. Let's see, Damian Pattenob.
Good evening, Damian Pattenob. I have the privilege of serving as the superintendent of the Renton School District. I actually went through the system, and it's been a real honor to have the chance to come back and serve in a community that's given so much to me. Grew up in the Skyway community as well as in Rainier Beach. And the regional aspect that's been talked about by several individuals has been what I've seen when you are facing the most difficult challenges. We can't just get caught up in these artificial boundaries that have been created, be those school district boundaries or city boundaries, and it's really going to take a full and concerted effort on all of our behalf to solve any of the adaptive challenges we face, whether that's around education and all the issues around COVID, or around homelessness, where in our district we've seen this conundrum of falling rates of students receiving free and reduced lunch, yet more and more families impacted by homelessness. And so it's just an honor to learn all about everyone's stories thus far, and I just look forward to serving alongside each of you.
Thanks, Damian. Sarah Rankin.
Hi, everybody. I'm Sarah Rankin. I'm a professor of law at Seattle University School of Law, where I also direct the Homeless Rights Advocacy Project there. I am a co-chair of the Third Door Coalition, which is an unlikely alliance of Seattle business leaders, researchers, and service providers who are aiming to bring supportive housing to scale in our region. And I am also a member of the Lived Experience Coalition, and very excited to see so many of familiar faces and some new faces as well. I would just reiterate, I agree with so much of what's already been expressed, and I
think you're freezing, Sarah. Okay, so Sarah, if you can't hear us, maybe try, we can't hear you and your screen's frozen, but maybe try dropping off and then coming back on. And then meanwhile, I'll call on Nate Caminos.
Thanks, Jeannie. Hi, everyone. Nate Caminos. I use he, him pronouns. A brief background on me. I was born in Hawaii, but spent most of my childhood growing up in South King County, and have since lived in several cities across the county in North and East King, and several neighborhoods in Seattle. My wife and I now reside in Renton. As a child, my family and I experienced food insecurity and poverty, and I have an immediate family member, my father, who's been experiencing homelessness for nearly 20 years as well. I've been heavily involved in social justice, civil rights issues, volunteered my time in youth and underserved communities, and served in various capacities in combating child hunger issues in our region. My wife and I have also opened our home as foster parents to newborns and toddlers these past 4 years. In my career, I previously worked as a union organizer for home healthcare workers at SEIU, spent time in Olympia and the State House on access to higher education, labor, community and economic development issues. I worked at Puget Sound Energy in the private sector and spent most of my time working with local cities, chambers of commerce, social service organizations countywide, and tribal governments and communities across Western Washington. More recently, I worked for U.S. Senator Maria Cantwell for 10 years and as their state director for the last 5, which included being involved in the creation of the federal policies like the low-income housing tax credit and its connection and impacts here to our state. In addition, I oversaw the Constituent Services Department, which acts as a dedicated resource for all Washingtonians in securing benefits and assisting their casework needs with all federal agencies here locally and back east. In the past year, I joined the external relations team here at the Port of Seattle. I've had a chance to work with some of you over the years, and some I'm meeting here for the first time virtually. The work that the board and the authority has just set out to accomplish is, like many of you, also personal to me, and I'm honored and appreciate the opportunity to serve here with all of you as our work together collaboratively gets underway. So thank you.
Thanks, Nate. Not present tonight, but one of your members is Reverend Dr. Kerry Anderson, who's the pastor at First AME Church. He was not able to attend tonight, but I'll be making sure to get him up to speed, and hopefully you will meet him at the next meeting. And then there is one more member who has been nominated and has not yet been confirmed by the governing board, and that's Michael Ramos from the Church Council of Greater Seattle. I believe he is listening in on this meeting tonight, just so that if the confirmation process goes forward, he will also have this information. I just wanted to make sure I let people know that. This leads us to the portion of our agenda where we have 10 minutes for public comments, and Carrie is just going to briefly explain how that works.
Great, thanks, Jeannie. We've set aside, I think, is it 10 minutes for public comments? So if you'd like to provide verbal comment, please type your name and the city from which you're calling into the chat function now. This will allow us to build a queue for that section of the agenda. In addition, you may use the chat function to provide written comment starting now until the public comment section of the agenda concludes. So we're going to go ahead and allow that function. Give me just a second.
I went ahead and did it, Carrie. We're good
great,
there.
Thanks. And Jeannie, I'm not seeing any chats come through, are you?
I am not seeing anything.
Just want to make sure it wasn't just me.
We'll just wait one more minute to see if anything comes in. And while that minute is passing, some of you may have noticed Leo Floor on the screen. And I'm sorry, Leo, we should have mentioned who you are, since Leo's the director of the Department of Community and Human Services. And I don't know if you want to add any words, Leo. Leo's also going to be talking quite a bit later in the meeting, but I apologize for not pointing out that you're there.
I'll take it while I can get it. And I also noticed that Sarah was able to rejoin, and so I would certainly defer to Sarah if you wanted to finish any other introduction.
No, thanks, Leo. I don't know what you all heard, but the last thing I tried to say was I'm ready to listen. So I'm excited to pass the mic to you, Leo.
Excellent. And Carrie or Jeannie, do we have any entries on public comment?
I do not see anything, so I believe we will move on to the next part of our agenda. And that is you, Leo, talking about some background and context and how did we get to today?
Great. So just as I guess a quick recognition, this is a really exciting moment, not for what we have done, but for what you all will do. If it wasn't clear from reading about each other, just in listening to you, this is a pretty potent group of people, and you could not have a more difficult task ahead of you. We seek to do nothing less than to reduce racial ethnic disparities amongst people experiencing homelessness, and then to eliminate homelessness. And once we finish that up, then I think we'll be ready to tackle the next thing. But the goal that I have today, and just to say, the board, you all, we won't be taking any action today. We won't propose any action for you all to take. So the remainder of this is informative. I will move through some material. If there is one way to not succeed at making a presentation, it is to use PowerPoint after 5:30 p.m. I'm going to hazard that anyways, but what I hope you'll be willing to do is to help mitigate that risk by asking questions, lobbing criticisms, asking for clarifications as we go, and really work to sort of defeat the nature of these types of presentations where it's easier to sit and listen as opposed to engage in conversation. So please interrupt freely. The first thing that I wanted to do, and we'll move through this relatively quickly, but is share with you all how we were talking about the regional authority about a year ago. And the idea here is so that you can get a sense of the trajectory, of the history, of the purpose, and really get a sense of the way that we were developing the idea and really advocating for the creation of the authority when this was still not a foregone conclusion. So this is a version of a set of slides that we used at several cities in front of councils to really try to identify what it is that we are seeking to do with the new authority. And you can see in yellow on the front page here, there are really three things that we're seeking to do in unifying this system. The first and foremost is equity. And those are words that I think are easier and easier for us to say, but making the changes continues to be difficult to do. And it's one of the things that we hope to do better at here. And we'll talk about that in a little bit more detail. But we also do have a system right now that by virtue of its structure remains a little bit inefficient and then a lot of bit inefficient depending on where you look. And then it's also the diffuse structure really lends itself to diffuse accountability. And so these are three particular issues that we're trying to solve through unified structure. Next, please, or next slide, please, Carrie. So this is just, to restate, we have a fragmented system. We won't spend a lot of time talking about why that is, but it is. And then we have a system that really has intolerable levels of inequity, and they are persistent. They've been there no matter when you look at the data, no matter how you look at the data, not to mention no matter what it looks like wherever you go and just as you encounter other human beings. It's really clear that the status quo right now perpetuates really intolerable inequity. Next slide, please. So fragmentation, I won't read all of these, and Carrie, if you can keep building it, it's just to say that this is not a controversial conclusion, that the system as it is currently constructed takes multiple levels of government, multiple funding entities, multiple measuring entities, and it is clear that that system does not create the conditions for unified action at scale. So you can just see that all the way back to 2016, we have sort of repeatedly as a community reached the same conclusion with respect to fragmentation. This is one of the central driving factors in what we hope to achieve with the King County Regional Homelessness Authority, which is that by unifying this structure, we'll be able to get a little bit bolder, a little bit more coherent, and able to move entire parts of the system at scale, which is what it's going to take for us to be able to do better at a problem that has been difficult to handle, not just in our community, but a lot of communities, and not just this year, but for years. Next slide, please. Our own King County auditor attempted to draw what the contracting structure looked like, and this was back in 2018. This is actually a much more simplified version of what the actual diagram would have to look like. I won't belabor this point. No matter who the stakeholder is, no matter what part of the system you look at, it's too complicated, it's confusing. And one of the things that we really see is, for example, right now, a contractor who's providing services to serve persons experiencing homelessness will likely have a contract both with the city of Seattle and King County, and perhaps with others, and often those contracts are with the same program. That program is providing the same services to the same people, and yet we have created this really complex regulatory and funding and measurement environment that makes it so that organizations are spending too much time talking to their funders and not enough time listening to the people that they're serving. Next slide, please. So in addition to fragmentation, the other issue that we have talked about, but sometimes it's useful to see numbers, and you know, these are numbers from last year, but they are not different than the numbers that you would see this year or different from the numbers you'd see before that, is a really staggering level of disproportionality. And to be clear, it is racial ethnic disproportionality. So we have communities, in particular, we have the Black African American community, and the American Indian or Alaska Native community, where the level of disproportionality could be explained by no other factor than that it is systemically caused. And those numbers are consistent over time. And then as a human services director, I can also say that those inequities are consistent across different types of human services work. And so all of that, I think, leads to what is really at this point, you could not arrive at a different conclusion other than that this is the result of an entire set of systems that creates and perpetuates these inequities. And I think one of the things that we see is that because these inequities are created by a system, that we could also design systems that did not create these inequities, that will not create these inequities. And I think that's one of our central organizing principles with the authority. Next slide, please. So we identified these two issues, and what we are really looking to do, and I think part of what is the charge of the implementation board is, one, let's solve the fragmentation issue. Let's unify efforts, understanding that whether it's a regional unification or it's contract level unification, that unity is going to be essential to move forward. And two, it is not sufficient just to observe and sort of continually lament the fact that we have a system that creates racial ethnic inequities, but that we could design a system that seeks equity proactively and in fact requires that progress be measured in terms of the degree to which it achieves equity. And that the way to do that is by centering the folks that the system serves. And we can talk about that a little bit more here in a minute. Next slide, please. Really quickly, this is, one of the questions that we often get is what about all the other things that we need to do? So we have, as a region, engaged with a number of folks, and this is one articulation of what is really a larger scale set of actions that we are seeking. The unification of governance, the things that we see in yellow here are things that we think are being addressed by the Regional Homelessness Authority. The rectangles that are in purple address other things that we also think that we need to do. Just to say it really quickly, one of the pieces of advice that we've received is the adoption of a unified theory of change across the entire system. I think one of the things that we have seen with the fragmented structure is that there are actually fragmented theories of what would work. And we are in the homelessness services area now sufficiently, we have enough data, we have enough history, we actually are able to identify the things that work. And these do not need to be philosophical conversations. They can be data-informed, data-driven, and values-driven conversations about what works. And that's the idea of a theory of change that everyone can really adopt in a unified way and move forward on. Governance, we've already talked about. Accountability to customers. So this is that idea of going from diffuse accountability to clear accountability, and that the accountability for a homelessness system ought to be to the people who do not have homes. And then the last part is that this is a unification of government, but we also do have a parallel process in which a lot of the private partners who also suffer from fragmentation are seeking to unify themselves as well. Next slide, please. We won't spend time here other than to say that, again, whether it's governments, the private sector, philanthropy, consultants, we have really tried to engage in overall strategy here, and that the implementation board and the King County Regional Homelessness Authority are a part of that. Next slide, please. And as Carrie builds this out, there is inevitably a question here, so I will do the awkward toleration of silence as somebody asks it. One of the questions that it will be important for you all to have a really clear sense of the answer to is, what is within the scope, what is being unified by the King County Regional Homelessness Authority, and what is not within the scope of the authority, or what remains outside of what we're seeking to unify. And the way that we were talking about this before the interlocal agreement was signed, and the way that it ended up being signed, is we're really unifying the crisis response system. And that is as opposed to the other parts of the system that are more upstream. So you can see in the diagram here that we've got services, and you know, for health folks, these are the social determinants of health. For housing folks, these are a lot of the types of services or interventions that just look like stable housing and stable communities. But all of the types of services that really would seek to intervene before homelessness is imminent are not within the scope of this authority. And then similarly, on the far right-hand side, permanent supportive housing, at least the creation, the capital function of creating housing, and again, in particular, permanent supportive housing, is not within the scope of the authority. And so it's really the set of interventions between those two things. It is the types of prevention that happen when housing or homelessness is imminent: outreach, diversion, operation of shelters, rapid rehousing, the entire continuum of care, which is the sort of HUD mandated and federally funded component of the homelessness service system, and it makes up a substantial amount of the overall funding. These are all of the things that are within scope of the regional authority. And another way to say that, because the regional authority is formed as an interlocal agreement between the city of Seattle and King County, is it is these types of programs that the city of Seattle and King County currently administer that will be transferred to the control of the regional authority. And another way to say that is this is the graphic depiction of the types of services for which you all, as the implementation board, will have oversight authority.
Leo, I think Harold raised his hand. Harold, did you have a question or comment on this?
So yes, thank you, Leo. What Leo's speaking about in the term is a housing first model. In my experience, we have the housing first model. I think Sarah Ray can speak more to this than I can. I sat on her doorstep one day because I needed to know this a few years ago, how I could be entrenched in this model. It's getting people off the street first and getting them in housing, in shelter. But we have to start at getting those shelters to respect human beings. We have so many people who won't go to shelter because they don't understand the housing first model. I was a trainer last year for the city of Seattle in getting learning circles for shelters, for rapid housing, for everything that was housing first. We didn't have a lot of people show up at first until we start getting the CEs involved, and then towards the end we have tons of people. We're still using that model at the city now for training. It is so important to understand that each of those items are part of a collective that works throughout the country. Because what works there might not work here. We see it working here. We just have to give it a chance. We can't let people say, I'm gonna do this or that. They have to encompass the whole as a housing first model. And it does work, especially those people who are chronically homeless. I'm one of those people, 10 years on the street. And yeah, I keep a tent, a sleeping bag, and my dog's collar, just so if I get out on the street again, I have a safe place, that tent. That's a mindset. You know, it comes from not being comfortable that the system's going to work for me because I don't see it working. A third of the people I speak with on the street won't go to shelter. And I'll tell you why. We did a little test at LEC, and I went to a shelter, just not even name it, went to take a shower, got out of the shower, someone picked up a towel, threw it to me and said, it's only been used once. That mentality has to stop. Human beings are in those shelters. If they won't go, then they're sleeping on the street. They're sleeping on the street, they're dying. So I don't know if Sarah wants to take over, but that's my opinion on just those things that this authority is in charge of.
And then I'll just note Simha also has his hand up.
Yeah, kind of going off of what Harold had mentioned, we had talked earlier about sort of the role of evidence-based approaches to care and homelessness, and specifically, housing first and permanent supportive housing is one of the, has some of the greatest evidence behind it, and was in fact pioneered here in Seattle, right? And so I guess my question is, even if this Regional Housing Homelessness Authority is not necessarily building permanent supportive housing ourselves, is it within our scope to make recommendations to say we need this amount of permanent supportive housing to achieve this goal, or we need, as you mentioned, like coordinating with other key systems, our recommendations are that jails or hospitals work in this fashion with us? I guess can we make recommendations to other things that are outside our specific scoping here is my question.
Yes. And in fact, I think there are several mandatory structures in the ILA, that will give you the opportunity to do that. And I think that sort of animating principle is that in this authority, now having unified it, you will be sort of uniquely positioned to share with people what is working, what is not working, what is needed. And so an emphatic yes to your question, Simha.
Leo, I also see a question from Helen in the chat. Where is the funding from services in permanent supportive housing going to come from? Does the authority have no involvement in funding services?
So this is it's an issue that was absolutely a live issue as councils were considering the interlocal agreement and as we were developing it. The regional authority itself does not have the ability to levy taxes. So that's a feature of the interlocal agreement that creates it. The regional authority does have the ability to work with other organizations, and it could fundraise otherwise or influence the fundraising operations of other entities. And the interlocal agreement sets minimum amounts of funding that the signatories to the interlocal agreement, and again, right now that's King County and the City of Seattle, must contribute to the operations. And then there is the COC money, or the federal money, and what we envision and what is now going to be in place should the Continuum of Care Board make the delegation, is that this regional authority will become the lead agency for the Continuum of Care, and assume that role that is currently performed by All Home. So another way to say that is we have created a structure here, and you all will have implementation authority over the federal money that comes from the Department of Housing and Urban Development. So that will come to the new authority. You will be assigned additional local funding that will come from both the City of Seattle and King County. And then you have the ability to seek funding from other, private or philanthropic sources, but you have the ability to provide advice to jurisdictions that do have the ability to levy taxes, but the regional authority itself is not able to levy taxes.
And Helen, I saw you also had your hand up, so I just want to make sure that covered your question.
Yeah, I'm good for now. Thank you.
Other questions? We casually referred to this as the what's in, what's out chart. There's a lot of detail below these headings, but if there's any other specific question that I could answer here, I think this is one of the key points that we hope you have a good understanding of coming out of this initial meeting of what is within the scope of the regional authority.
And then Gordon has his hand up as well, Leo.
Hey, Leo, it's Gordon. I put a question in the chat box, but I also like practicing my competence with Zoom, so I raised my hand. I agree clarity on scope is really important for us and for the system we're going to be a part of. Can you give me an example or examples of downstream prevention as described on the chart?
Yes. So one set of examples, and it's one that you may be familiar with, Gordon, is the work that the RAPs do, the regional access points, where the majority of folks that are coming in seeking services to the RAP really do have a sort of imminent homelessness concern. And so the types of eviction prevention, rental assistance, financial assistance that we might provide at a rapid access point, I think is an example of downstream prevention. And that is distinguishable from, perhaps some sort of job assistance or, rent stabilization or some other type of intervention that you can imagine that is available to somebody, even if they are not about to become homeless. It's an important point here that, as folks on this board know, a lot of services are the funding for them. A person does not become eligible until they are either homeless as a fact, or maybe that homelessness is imminent. And so that's another way to look at this, is a lot of those funding sources that require actual, literal, or imminent homelessness are within scope, while some of the funding sources that attempt to prevent that condition in the first place would be out of scope.
Great.
And
I appreciate that. Oh, sorry. I was saying, thank you.
Go ahead.
Really appreciate that conversation. I imagine as we progress in our existence, we're going to be refining that, and of course, getting clarity on, what's in, what's out in terms of strategies and tactics. And as you pointed out, Leo, also on resources. So I'm good for now. Thanks.
And I see a question from Sarah Rankin in the chat. Is it possible to get some background on why permanent supportive housing is not within the scope of the authority?
Yeah, absolutely. And what you'll see there is there's actually, it's not just bad PowerPoint skills, but the sort of bisection of permanent supportive housing there. What we're really trying to demonstrate is the way that the regional authority is currently built. It's the capital function, and then all of the functions that assist the capital function will remain with local jurisdictions. And to say that clearer, like the Seattle Office of Housing will still administer its housing levy to create permanent supportive housing units. And one of the big things that was important there is that the existing jurisdictions have a lot better sort of credit structure, have a lot of the infrastructure that's necessary to really take on that capital creation function. Whereas the services really we're trying to designate or tie that might be in those buildings are tied to the regional authority, so that we've got cohesion between those services and other services that the regional authority will oversee. So it was very much a background about the regional authority, since it won't be able to generate its own revenue, and then since it doesn't have a lot of the other municipal structures that we currently in our current system depend upon to be able to create capital and actually build housing, that stays out while the services stay in.
That's all the comments for now, Leo. Would you like me to end the slides or keep going?
We could keep going here. We, I think, are getting closer to the end. This is just one way to render this, but when we talk about unification, you can see one way to unify is programs. Another way to unify is funding. And then what we're really trying to depict here is this is the first attempt to bring into one structure all the different oversight. You may have heard Adrian in her introduction referred to the fact that previous sort of versions of our system might have unified the responsibility for homelessness in one entity, but without unifying the resources. And so for the first time, what we're trying to do is get into one set of interrelated boards all of the resource control, all of the decision-making authority, and all of the responsibility. The governing board, what we were calling the governing board, is now called the governing committee. And what you can see here is that we actually shifted the structure between how we were talking about it a year ago. So that committee is now larger. It has 4 blocks, if you will. 3 representatives from the city of Seattle, including the mayor of Seattle, and 2 from their council. 3 representatives from King County, including the county executive and 2 members of the council. 3 representatives of the Sound Cities Association, and then 3 representatives representing persons with lived experience of homelessness. and that makes up the governing committee, as we now call it. And then you as the implementation board. And just to dwell on this for a moment, one of the key criticisms, and there were actually many forms of this criticism of previous versions of how we've overseen homelessness, is that it was too influenced by blank. So for some folks, it was too influenced by elected officials. For other folks, it was too influenced by providers. For other folks, it was too influenced by people from this city as opposed to that city. Too influenced by, blank. And so in many ways, another thing that everyone agreed on is that because of all of that influence, experts and data were not really able to drive decision-making. And that is you. You are the experts. You are the sort of core oversight that the proposal attempted to sort of give control of, or give control to, while insulating you from the blank that many different stakeholders thought had too much influence on the system. And so the structure that you see here, another way to look at it is there are no current elected officials among you. There are no current service provider representatives among you. And you have, you are here because of your expertise. And you will be connected above you, to use that hierarchy, to a board that is composed of elected officials so that there is political control and oversight over some key decisions and factors. And then you are accountable below to an advisory committee that does not have a lot of these same restrictions, and that the COC board will have the opportunity to actually nominate itself to become that advisory committee, and that's how we'll get full vertical integration of all levels of governance of homelessness. And then the last thing to point out here is that all levels of governance are intended to have a meaningful proportion of required and co-equal members who are there because they have lived experience of homelessness or represent people with persons with lived experience of homelessness, which is a feature that is, we're our first jurisdiction in the nation to formalize, require with this proportion that level of leadership for folks who have lived experience of homelessness, which is a part of what it means to center a system around the people it serves. Go ahead.
Leah, I see Helen's raised her hand.
Just a quick question about the role of the COC board. It's labeled advisory committee, and yet you suggested in your previous explanation that the implementation board would be the entity kind of making decisions around federal funding. So I'm just trying to understand how this all fits together. Thank you.
Absolutely. Thanks, Helen. It's one of the issues we're trying to solve for here is what is the local government competent to assign control of versus what is the federal government competent to assign control over. And so the COC board has the ability to delegate or to assign control over the COC funds or to coordinate the provision of the COC funds. And I see I might be the one. Am I freezing up where people cannot hear me right now? Okay. And so the problem we were trying to solve is how do you recognize the fact that the ILA itself, because it's between Seattle and King County, could not assign control over the federal funds, and only the COC board may do that. And so the theory is by putting these into a vertical alignment, either by coordination or by assignment, and that's a choice that the COC board will have to make, that we created the possibility of control or influence and coordination between those levels that doesn't exist right now. So another way to answer that, Helen, is the structure is there, but the structure, while necessary, will not be sufficient, and we're going to have to get some delegations of power done in a way that fully realize that.
And I see Harold has his hand up and Helen again.
I might be going ahead. The last statement was hitting the nail on the head for LEC, Lived Experience Coalition. As you remember, when I first started with the city a year and a half ago, we had a meeting with Mark Jones and NIS, and we were just formulating and getting community comment on it. And I love Mark, and we met since then, but I took him to issue when he said, lived experience people do not have the competency because they're under stress. And I took him on that. And that is one of the reasons that LEC was actually put into the mesh, into the game. Because I asked him, who doesn't have stress in this time? I have worked my butt off to get from homelessness to home. It was easy for me to go from home to homelessness. But getting out of it, mentally, physically, it was a chore. And yes, I was stressed. That did not mean I didn't have the competency to be at the table. And over many months of talking and meeting with community, LEC was there. And we're having this thing in the background now that LEC is being moved out of that advisory position for the positions on the governing board and on this implementation board. That was our role, to look for people who had homelessness, not the COC's board. Mr. McCary, listen to me and don't think I'm going out of whack here. Mrs. Levine is the head of the COC right now. She's vice president of United Way. Mr. Henry is CEO of United Way on this board. Jointly from the city and from the county, they've received $3 million in funds. Kurt works for Solid Ground. He worked under Mr. McHenry. Myself, United Way helped me and my parents in the 80s bury my uncle who died of AIDS. 2 years ago, I knocked on United Way's door and begged for a second chance and to give me a VISTA position because you know I qualified to work in the city under HSI. We have intersections here that we need to break away from. I love United Way, but I'm not afraid to say to Mr. McHenry, there's intersections here that you should excuse yourself from. There's intersections here that I should maybe excuse myself from because of the emotional attachment that United Way has done for me. But let me be clear. All of us come from a different background, but we all have been in the Seattle area and we mismatch, come up and go against, and then partner with the same people all the time. We trash the same ideas over and over again. The theory of change has to be coming up in a vibrant way. This experience has to come to the table, not just come to us to speak, not just listen to us, but take on some of our thoughts and interact with us, because we need to hear yours too. So listen to the interactions. Yeah, we see each other and we know each other, but are we not afraid to take on each other and challenge those ideas that have just not worked? And I'm open to those as well.
Gordon here. Thank you, Harold. I appreciate, I'm working to understand you and I appreciate you sharing, and I look forward to understanding where those intersectionalities pose a weakness or a constraint, and where those intersectionalities and relationships empower us to be really effective toward these goals. So I look forward to it. And I appreciate your candor.
And Helen also had her hand up.
Nope, I'm done. Thank you.
Next slide, please, Kara. So, in some ways, the purpose of this slide today is to share with you all some of the obligations that or aspirations that we shared on your behalf before the board was formed. And so one of the real questions is if inequity is so intractable and we have not yet addressed this in a meaningful way, what gives you confidence that by changing structure you could? And something that might not jump out upon first reading in the interlocal agreement, but which we would invite everyone to look for, is that the interlocal agreement does require a number of pro-equity features that are new or unique or unprecedented in these types of agreements. Some of them have the feel of bureaucracy, and some of them have the feel of being something much more substantial than that. But rendering them together here, the goal is so that you could see what structures are there. So I won't go through all of these, but one thing that I will highlight is equity-based decision-making framework. And so this is a requirement within the interlocal agreement that the regional authority and this implementation board will have a role in approving what that framework is, but that whether or not a decision, policy, funding allocation is likely to have the effect of reducing inequity or creating more equity is up there with whether or not it's financially feasible or any other measurement that we would affix to something, and in fact should be a guiding principle. We have spoken, and I'll seek to add nothing to what Mr. Odom mentions about both the potential, but also I think where we need to get with inclusion and full integration of leaders with lived experience at all levels of governance. The board composition in and of itself, your board has several features of composition. For example, a majority of you must, by your identity, be able to represent and be accountable to persons or communities that disproportionately experience homelessness. And then as we look inside the ILA, there's a lot of the sort of detailed work around how performance measures, customer accountability, and again, a requirement for a theory of change that all seek to structurally change and reorient our work around equity. Next slide, please. Not a lot of time here. Basically, if you go through one central organizing entity, which is the authority, we have the ability to, a contractor should have a contract, spend less time reporting the same data to multiple folks, and more time serving persons experiencing homelessness. Next slide, please. And then accountability, this really has to, these are all symptoms of having cured fragmentation, or when we cure fragmentation. The clarity that comes whether you are a customer of the system, whether you are a funder of the system, whether you are an interested resident of King County, it will be clear to where those folks should be able to go to see what's happening and express their pleasure or displeasure with how that's happening. And just, that last piece here, and then this was just a conclusory slide. We've got a new website and we'll send it out, but the level of sophistication of data that will be available to you is something that we'll spend time in the future really going over. We've had a couple of national consultants, including the Corporation for Supportive Housing, or what used to be that, now I think they just call them CSH. Called themselves CSH, have noted that you all will have a data infrastructure in the homeless management information system and its integrated accessory systems that is among the most sophisticated in the country at this point, which is not to say that it does not have more to do, but you will have a lot of data and well curated data at your disposal to see what's working and what's not working. So that's the end of those slides. That's a little bit slower by way of the agenda. The remainder, I think we can move through much more quickly, but if the overall goal is just a sort of sense of orientation for all of you to know where we are coming from and where we're headed, and then really role clarity for the implementation board relative to the other parts of the structure. If there are any questions or comments that any of you might have or that I can answer, I'd be happy to right now before we get into the next piece.
You have a question from Simha?
That idea of making sure we know where we're coming from and what's been done before, are there things like the regional action plan that had been worked on previously, or the CSH, the various consultant reports? Is there a central place where we can go to review those things to make sure we're kind of caught up?
Excuse me, there is. We've got a sort of placeholder website that I'll make sure everybody here has a link to. It contains a lot of those reports, and then we'll try to pull out a couple of those that are going to be most useful to you. Most recently, we do have a National Innovation Services sort of system audit that we'll share. And then, as you mentioned, Simha, there has been it's not completely done yet, but there's a regional action framework, it's now called, that really, I think, lays out a methodology that will inform a lot of the planning that you all will oversee. And then the last piece, there's the website that I was just alluding to. You know, we've got folks who have participated in a couple of efforts in the community that I think should also inform these efforts. And so the Third Door Coalition has done a lot of really good analytical work around particularly the provision of permanent supportive housing and the role that it can play in homelessness. And we have our point in time counts that, you know, the count in and of itself, I think, is of limited utility, although it's useful, but the reports that really come with it, I think, give a much richer sort of understanding of another way to look at who is experiencing homelessness. So there's a lot out there, and in fact, I don't think it's a dearth of data that will be your issue. I think there's actually, it's a, how do we curate that for you so that you can extract from it what you need to meaningfully oversee what is in scope for the authority. All right. So we are approaching, you know, probably not only the expiration of my time, but also body language indicates that it is true that PowerPoint is tough after 5:30. So rather than going through documents for the rest of this, I think the last 2 points that I'd like to make is at the next meeting, we'll want to sort of answer any detailed questions you have about the way that the implementation board can and should interact with the governing committee, interact with the regional authority's chief executive officer, and then with the advisory committee or committees. I won't spend a ton of time on that here, but as you have a chance to be more familiar with those documents, we'll provide a summary document, and you've got a version of that in the materials that were emailed to you, but that is really a key question. I don't want to pretend that this was as simple as just forming one board. You've seen we've got sort of layered governance, and that's how we were able to strike the balance that allowed us to unify it. And there is some complexity between those boards that you know, we have written about and you all are about to live for the first time. So I think that's going to be one of the key questions. The other thing that I would just like to introduce here, although you'll not be taking action on any of these, is you've got some decisions that are coming up pretty quick. And so this is a chance just to brief you all on where we are. So you saw a bunch of timelines. Fast forward, it all culminated in the passage of an interlocal agreement at the end of last year. And the interlocal agreement is sort of the controlling or organic ordinance that creates you and the authority. By the time convert the potential within the interlocal agreement into an actual organization. We have now seated that governing committee, and then they in turn have seated you as the implementation board. We do not yet have the advisory committee. So the continuum of care is in the process right now of reforming itself so that it may nominate itself to you for your approval or disapproval. And then we'll have full governance. At the City of Seattle and King County, we've been plugging away really for the last year. And I've got a bunch of frozen faces again, so if I'm breaking up somebody, there we go. For the last really year, the teams at the City of Seattle and King County have been working really hard to begin to conceptualize how we will transfer all of the, I don't think I've thrown this number out there, but if you add up all of the amounts of money that, at least as an initial matter, the authority will have control over in its first year, it's just over $135 million of total organizational budget. And all of that is currently deployed in programs and contracts that we must sort of assign eventually to the new authority so that the new authority can then RFP them itself and then issue unified contracts. And so we've been working on that and all of the staff adjustments that must go into that. And just to, one of the things that I'll just say, is this has been a lot of work for staff who ultimately will not, in many cases, have ongoing roles at either the City of Seattle or King County, so that the new authority can take those resources and employ its own employees. And so that is important, and it's been difficult work for those teams. And so just a recognition of that difficulty for them. The moment we are at now is the next big thing we need to accomplish is to hire a chief executive officer. And so a lot of the decisions that you'll make over the next couple of months have to do with either the hiring process for the chief executive officer themselves, or in creating the organizational preconditions to be able to actually pay, hire, insure, provide benefits to the first employee of the authority who will be the chief executive officer. So we won't dive too deep into the details, but that's the overall focus of a lot of the decisions that will be presented to you in the coming weeks. Just to say a couple of those, we will have to take a look at insurance. We'll have to take a look at authorization of initial hiring of legal counsel, of by what payroll system will the new authority, some of that nuts and bolts stuff is actually going to come before you, and it is not exciting, but it is essential. And then you will have some sort of internal regulatory matters that come before you. Who will your chair or chairs be? Adoption of bylaws, and then a meeting rhythm, which I think is a final item. I want to just, I think I see John.
I'm sorry, go ahead and complete your thought, but then I did have a couple of quick questions.
It was only to say that you all have been very gracious in assembling very quickly with relatively little notice, and so we are grateful to you for that. And I think one of the first orders of business, perhaps between this meeting and the next, will be to identify some sort of predictable rhythm so that you all can plan around your participation. You have a requirement to meet at least 6 times a year. I do believe in our analysis that we will ask you to meet more frequently than that in the first year of your existence, particularly between now and the month of October. And we do believe that it will be sometime between September and October where you will have the ability to take a final vote in partnership with the governing committee to choose the person who will be the first chief executive officer of the new authority.
Okay. So Leo, it's my understanding that a firm has been hired to do the recruiting. Do you know how far along they are on their work of developing a recruitment packet? Are we able to get any of that, or were they waiting for the implementation board to get seated?
Finalization of a lot of these decisions has been awaiting your arrival. And so it's a company called the Hawkins Company. We have completed a search, and the governing committee has provided initial approval to bring that firm into place. And the thing that we are finalizing now is that scope of work for them. And then the types of things that they will start to bring to you are their concept for community engagement around the CEO hiring process, the hiring package, and the job description for the CEO when the procurement goes out to hire them.
And so when might we begin to see that sort of thing coming before us so that we can at least review?
I think as soon as the materials are going out for our next meeting, it is going to be happening that quickly.
Right.
And that is it for the project managers out there. CEO hiring is the critical path right now. Everything flows through that. And again, we are seeking to get that done in September or October at the latest.
And then really briefly, of the contracts that Seattle has and King County have that we will be kind of getting the control over, what is the schedule of when those run out? Because that clearly drives, I mean, we can't be in a situation where, we haven't been able to let contracts. And it's going to take a while to get RFPs, et cetera.
That's correct. Our planning assumption from, and I speak for King County certainly, and then with the leave of the City of Seattle, I'll represent them and they can correct me. But we talk about this a lot. We do not anticipate that the regional authority will be in a position to execute any of its own RFPs this year. Or certainly not for any of the existing contracts. And this is normally the time of year that we go into contract renewal where contracts will remain, in the next year. So our approach is to stabilize existing contracts this year for next year, assign those to the new authority, and then that puts the new authority into place to begin RFPing with staff having been hired in the first half of next year. By the first half of next year, and then RFPing by the second half of next year. So 2022 really becomes the first year in which we've got fully unified contracts coming from new authority RFPs. There will be some exceptions where there's a new program as opposed to one that we are assigning from King County and Seattle.
Thank you.
All right, it's 6:29. I'm assuming no more questions. I just want to quickly tell you all, I've had a couple questions in the chat. We will share the slide deck that Leo shared with you all. This meeting is being recorded and the recording will be posted on the Regional Homelessness Authority website. We are working on the next meeting for you all, which will be the week of August 24th. And we really appreciate you all responding to the doodle polls and your flexibility around scheduling. And then we intend to have a regular meeting time starting in September. And if you haven't already been contacted about that, you will be very soon. I also just want to note that typically Jason Johnson, who is Leo's counterpart of the City of Seattle, will be at these meetings, along with my counterpart, Sola Plumacher. They're both on vacation this week, and they felt like getting you all together was so important that they asked us to proceed without them. So I just want to make sure you all know they will be part of this. And with that, I think we are ready to adjourn unless there's anything final that anybody wants to say.
I'll just really quickly, you will not have to endure me for many months. We do intend eventually the CEO and their staff will become the staff to you. And so, Jeannie and me, and then our counterparts at Seattle will sort of be placeholder staff so that we can move forward. But eventually you will no longer have to endure me in the evening. So.
Thanks, everybody. We will be in touch.
Thank you all.
Thank you, Jeannie. Thank you, Leo. And nice meeting everyone.
Thank you.
Thank you.